Hey Faye, how are you?
Good, thank you.
Okay, what we're going to do today is we're going to work on your program that we've made up for you. This is a 6-week all-body endurance program, and it's designed to help you manage your diabetes. It's also going to help your weight and your blood pressure. I've received your referral by Dr. Kelly, and I've had a look through that, and I've incorporated this program taking all those things into account. What we're going to start with is an extended warm-up, and the reason we're doing that is because of your diabetes and your blood pressure. So we're going to be doing that warm-up on the bike today, and we're going to start with having your intensity around 40%. I can see you've got your heart rate watch on, so we'll use that to monitor. And then throughout the 10 minutes, we'll gradually increase that intensity up until that 70% of your maximum heart rate. Did you have any questions about that warm-up?
No.
Okay, so let's head over to the bike, and we'll start that 10 minutes. Okay, how did you feel through that warm-up?
Yeah, good.
Feeling
Yeah,
good?
feeling warm.
Okay, excellent. All right, we're going to start with your resistance program today. The exercise we're going to start with is squats. Have you done some squats before?
Long time ago.
A long time ago. So we're going to take it easy with these ones. As the program goes on throughout the 6 weeks, we'll increase the intensity. So we're just going to do body weight squats to start with. And I'm going to get you to do 2 sets of 15 reps. Our squats target our quads and our hamstrings and our glutes as well. And it's really important to make sure you're using the correct technique. So I'm just going to show you the technique to start with. I want you to have your feet shoulder width apart. Make sure you're bracing your abs throughout the exercise. I like to have my hands here, but you can have them on your hips, or it's up to you. This sort of helps with stability and balance. So feet shoulder width apart. Make sure your pelvis is back and your bum's out. So if you're going down, make sure your knees track your toes and they don't go over your toes too much. And make sure you keep your chest up, so don't lean forwards. So we'll go down and then back up. And then down, and just go down until it's comfortable for you at this stage. And back up, down, remembering to keep your hips facing forwards, your back nice and straight, and your abs braced. So have a go at those for me. We're going to do 2 sets of 15. How's that feel? Is that as low as you can go being comfortable? Yeah. Good. Back's nice and straight. Make sure you're tucking those hips back as well. Yeah, perfect. Good, couple more. Make sure your knees aren't going over your toes when you're performing this exercise.
Is that better?
Yeah, good. How does that feel?
Good.
Good. One more and we'll finish off those 15. Good. Now we're going to have a 60-second break. That was really good technique, and it's really important to make sure you maintain that technique. The technique's the most important thing rather than getting lower or doing more reps. It's important to make sure you've got that technique. Okay, now we're going to do another set of those squats. Good. Perfect, that's looking really good. Good. 14. 15. Perfect. Okay, I'll give you another 60-second rest. We're going to move into wall push-ups now. So like I said at the beginning, we're starting off with low intensity, so we're going to be doing body weight today. So I'll get you to come over here to the wall. I'm going to get you to put your hands shoulder width apart. And if you go up on your toes for me, and you're just going to lower down towards the wall and then push up. Down towards the wall and push up. And you should be squeezing in between the scapula when that's happening as well. Yep, perfect, good. And your body's looking nice and straight. So I'll get you to do 15 of those. Good, how does that feel?
Good.
Good, no pain? Excellent. That posture's looking really, really good. Perfect. Okay, one more. Excellent, good job. So now you have a 60-second rest, and then we'll do another set of those. Okay, the next exercise we're going to do is our band row, and we're going to be doing 2 sets of 15 of these as well. For this one, the muscles that we're targeting are our lats and our traps at the back and our biceps. So I'll get you to sit down, hold the band within your hands, make sure you've got a nice straight back. I just want you to pull that band back. Make sure the movement's nice and controlled. Don't be jerking the band. So back and forwards, back and forwards. Make sure when you're sitting down you're at a distance where your arms are straight at the end of the movement. And again, like that push up before, you'll be squeezing the scapula together at the back. So if you want to sit down, get the distance right first. Yep, perfect. Yep, so back nice and straight, that looks good. When you're ready. We're going to do 15 reps of this. Good, and squeezing in between here. Yep, perfect. How does that feel?
It's hard.
That's good. It's not too hard?
No, it's okay.
Good, excellent. I like how you're doing that in a slow, controlled movement. That was really good. Good. 2 more. Good, excellent. And can you feel that through your upper back there and your lower back? Excellent. Okay. Alright, we've got 2 more exercises in our program today. We're going to do seated dips for this one. And again, starting off with a low intensity, we're just going to use our body weight. So I'll get you to come over here. Our seated dips are mainly targeting our triceps. So I'll get you to start by sitting on the bench. Your hands are going to be shoulder width apart and legs out. Your legs are going to be at about a 90-degree angle. To make this exercise a bit harder, you can move your legs out. But to start with today, we're going to have them here. And all you're going to do is lower your body down and then come back up. Down, come back up. Make sure your shoulders are in and make your backs nice and straight. Any questions about that one?
It's 5 o'clock.
Yep, perfect. Good, do you want to move your feet in a little bit more? Yeah, good. Just because today we're keeping it at really low resistance. How does that feel? Can you feel it in here? Good. Excellent. One more. Fantastic. And like I said, as we move through the program, we'll make it a bit more difficult by moving your feet out. Yep. Okay, our last exercise for today is crunches. Again, we're just going to be using body weight today. For this one, I want you to come to the mat. Sit down. When you lie down, it's really important that we don't have an arch underneath our back. So if you are finding that is the case, just bring your legs up and it will get rid of that. So if you need legs up, I'm going to get you to put your hands by your side, or you can cross them over your chest. And you're just going to bring your body up and crunch. And you can tap the floor if you like. Make sure it's a nice, slow, controlled movement. And make sure you're really bracing your abs. This exercise targets our abdominals, obviously, and our internal and external obliques. So I'll get you to come down. We're going to do 2 sets of 15 reps for this one. So make sure you don't have an arch. Yep, that was good. Hands feel more comfortable there?
Maybe here.
Yep. Good. And make sure you're really bracing those abs when you come up. Excellent. So you can go up a little bit higher. Excellent. How does that feel? Good. Can you feel it in here? Excellent. Couple more. 2. And make sure you're not using your neck and your head to pull up as well. Excellent. Okay, I'll give you a 60-second break, and then we're going to do another set of those. Okay, now that we've finished our resistance program, okay, we're going to move into our cool down phase now. Our cool down phase is really important because it lowers our heart rate gradually and slowly, and allows our respiratory rate to go down. It's also really important because it gets rid of that lactic acid that can build up and can make you feel a bit dizzy after a workout. We're going to do an extended workout for you just to help bring things down because that's really important. We're going to do this on the bike as well, and we're going to gradually decrease the intensity. So whereas in the warm-up we started at 40% and we slowly brought it up to 70, we're going to start at 70 and slowly decrease it to 40%. Also after that we're going to do some stretches. It's really important to stretch before and after a workout to make sure you don't injure yourself. So we're going to stretch our chest, our hip flexors, our lats, our lower back, our quads, our hamstrings and our calf muscles, because they're some of the muscles that we use today. Do you have any questions about the warm-up? Okay, let's head over to the bike. Okay, what we're going to do now is I'm going to ask you a couple of questions about how you felt about the session, and then after that I'll explain to you what we're going to be doing in the next couple of sessions. How did you feel? Were you satisfied with the program today?
Yeah, that was good.
Yeah. And did you feel that we're aiming to include an all-over body endurance program for you, especially to help manage your diabetes and your weight and blood pressure? Did you feel that this program targeted those objectives that we had?
Yeah, I think so.
Yep. Was there anything else any other questions you had or anything you wanted to add about the program?
No, I feel pretty good.
Yeah. And how did you feel about your performance today?
Yeah, I think I could do better, but
Yeah. Well,
maybe
it was only
in
the
coming
first time,
weeks.
so
Yeah.
that was good. This was sort of a good introduction to get to know the exercises that we're going to be doing. Okay. So as I said earlier, this is a 6-week program. The part that we just participated in today was the resistance program, and that will be completed 2 days each week, and it's important to make sure you have 2 days rest in between those sessions. It's also important that we incorporate some cardio training, and that needs to be completed 2 to 3 times a week, again with 2 days rest, so we can sort of alternate that resistance and cardio. For your cardio exercises, are there any classes that you're particularly interested in, or aerobics or
Yeah.
step class?
Probably.
So we can do a class like that, or an aqua class. I know you mentioned that you liked that a bit earlier. And also to mix it up a bit, we can do intervals on the rower, the bike and the stepper, and alternating your intensity with that. Okay, did you have any questions at all?
No, sounds good.
All right, thanks so much for coming along today. You did a great job.
Thank you.
Thanks.